What's going on, guys? Welcome back to another video. Today I'm going to be talking about the highly controversial topic of patient care versus healthcare experience. Here we go. Yes, I'm wearing a hat today. I didn't feel like doing my hair. If you guys are pretty active on Facebook and Instagram, you know that there's been a lot of controversy and a lot of discussion about CASPA and their guidelines for what counts as patient care versus healthcare. I just want to clarify and give you guys my opinion and suggestions on how you should approach whether to consider your experience patient care or healthcare. Again, this is my own personal opinion, but I think it's a good solid foundation and base to go off of to see what category your experience falls under. So before, as you can see here, CASPA didn't include CNA under patient care experience. They had it under healthcare experience. And if you look now at their updated patient care experience and guidelines and healthcare experience, you can see that CNA is included under patient care experience. So patient care experience is anytime, in my opinion, when you're providing some type of care or assisting in treatments or procedures for patients and to overall help their well-being, and when you're directly in contact with patients. You don't have to be the sole provider for a patient, but as long as you're actively assisting in the treatment and care and you have that direct patient contact, I consider that patient care experience. Healthcare experience is anything that I consider to be in a healthcare setting, like in a clinic or a hospital, but you're not doing anything directly patient care related. So what I mean by that is you are probably doing administrative work or cleaning beds, cleaning rooms, changing rooms, transporting medications, things like that that aren't necessarily focused on the patient, but you're still in a clinical setting, so that does count as healthcare experience. So as a physical therapy aide, I was very hands-on with my experience, and I was with patients probably 80 to 90% of the time, but the other 10 to 15, 20%, I was calling insurance companies, I was booking appointments, I was folding laundry, cleaning beds, and I considered that experience, healthcare experience, and my direct patient contact as patient care experience. And when you put your experience into CASPA, you can list it as both patient care and healthcare as long as you split the hours accordingly. So how do you know if your experience counts as patient care experience? Some questions you can ask yourself are you directly assisting the patient? Are you doing hands-on procedures or treatment that's overall helping the patient's well-being? Again, you don't have to be the sole provider. You don't have to be the physician or physical therapist or the nurse practitioner in charge. As long as you're actively assisting and providing hands-on patient care treatment, I consider that patient care experience. So CASPA even states that their guidelines are just that, guidelines. It's something that they pile together from feedback from different PA programs, and they use these guidelines just to help you distinguish between patient care and healthcare experience. And two very important points I want to make are that first, it's very dependent on your own personal experience. MA, according to CASPA, is listed, MA being medical assistant, is listed under healthcare experience. But I know a lot of MAs that do very hands-on work assisting in procedures, assisting in providing care and treatment for patients in a clinical setting that most, if not all, programs would consider patient care experience. But like I mentioned, it's all dependent on your own personal experiences and your own responsibilities and duties. I know a lot of MAs that are front office MAs that only do administrative work. So I would consider that healthcare experience because there's not much treatment or care directly provided to patients. Back office MAs that assist in procedures and assist in providing treatment, I consider that full patient care experience. So again, it's all dependent on your specific experiences and your clinic that you work at and how hands-on you really are with patients. My second point that I want to make is it's also very program dependent. And I'm going to show you on the screen what my program considers direct patient care. So as you can see, direct patient care should involve patient interaction with exposure experiences that enable you to utilize skills or medical terminology in a clinical setting. And as you can see, EMT, physical therapy aide, CNA, medical assistant are just a few that are considered full patient care experiences. Some experiences that my program doesn't count towards patient care experiences are things like shadowing, student interning, home health aide, CPR trainer, vet tech, clinical front desk, which is basically administrative work, just to name a few. So something to keep in mind is if you're an RN or a CNA, Most programs don't accept your student training hours as patient care hours because you're still training. So let's take a look at Duke PA program's patient care requirements. As you can see, they don't accept student experiences, shadowing, clinical experience as a student EMT, student nurse, student athletic trainer, or intern to count as patient care hours. On the other hand, let's take a look at Stony Brook's PA program patient care requirement. As you can see, Stony Brook allows up to 500 patient care hours to be fulfilled with clinical training, aka your rotations when you're pursuing your BSN degree, or your training to become an EMT, or your training to become a CNA. Those hours, up to 500, will count towards Stony Brook's patient care requirements. Stony Brook even allows up to 200 of those hours to be shadowing. And a lot of programs don't allow shadowing to be mixed in with direct patient care because you're not as hands-on. But as you can see, and as my point to get across is, it's all dependent on your own personal experience, and it's very dependent on the program itself and what they consider patient care experience. So just to recap, and I've said this multiple times throughout this video, it's all dependent on your own personal experience. Not all medical assistant positions are created equally. Some are much more patient care focused, some are more administrative focused. It's really dependent on your own experience. And secondly, it's very dependent on what your programs consider patient care experience. So it's important to find out if your experiences count as patient care experience. So either go to the school's website or email an admissions counselor and figure out what they consider patient care and if they'll accept your hours as patient care or healthcare experience. So my general rule of thumb is if one school accepts your hours as patient care, list it under patient care in CASPA, and the schools that don't count it as patient care, let them make the decision to consider those healthcare hours so you don't jeopardize your chances at a program that does see them as direct patient care. Hope this video was helpful. I'm leaving for Nevada in 10 days. I am so excited. I have about a month before my orientation starts. So we finally hit 3,000 subscribers on the channel, and I just want to thank you guys from the bottom of my heart for all the support, for following me on my journey, for allowing me to, help you guys in your journey as well. So thank you guys, and I'm just so humbled, I'm so blessed, and even more excited to take you guys on my journey in PA school. Don't forget, you can connect with me on Instagram. Feel free to DM me any questions you may have or comment below. Don't forget to be like my blood type, be positive. I'll see you guys in the next one. Peace.